Welcome to another episode of Into Their Minds in collaboration with the iGEM 2023 team of ITM. I am Roshida and I'm part of the iGEM team this year. So iGEM is, for those of you who do not know, iGEM is an international synthetic biology competition which aims at solving real-world problems using tools of synthetic biology. And this year we are trying to develop a diagnostic tool for diagnosing MDD, which is your major depressive disorder, on a microfluidic chip. And this collaboration is the result of one of our outreach efforts. I'm also part of the Into Their Minds team, and Into Their Minds was started with the intention of promoting active discussions within the science community. And we have done a lot of interviews previously with eminent personalities. And today we have with us Dr. Samir Parikh, an eminent psychiatrist who has played a significant role in enhancing the image and reach of mental health across the country. He is the director of Department of Mental Health and Behavioral Sciences at Fortis Healthcare, and their national health mental health program is one of the very few comprehensive multi-city, multi-centric mental health care programs in the world. The work done by their department spans over 15 crores of lives. Thank you so much for accepting our invite today and being ready to talk to Dr. Samir. So welcome once again. And thank you so much for accepting our invite and taking your time out to talk to us, Dr. Parikh.
Pleasure.
So, mental health awareness is something that has become mainstream very recently, especially after the COVID pandemic. But, sir, you have been working in this field for over 20 years now. And from the perspective of a psychiatrist, how do you define mental health?
So it's not about how do I define mental health. Mental health, it's an entity. I mean, all of us need to see it and to be able to understand and define it like anybody in any part of the world would. I mean, at the end of the day, mental health is a part of health. And if you remove the word mental from health, which means the psychological, social, emotional aspects, then what is health? So see it like that. And for mental health to have, let's say, the ideal mental health, you're looking at an individual who are able to, let's say, recognize and work with their strengths, have a good positive sense of self-esteem, are able to go through the ups and downs of day in and day out stresses that we have and are able to use their resources to be able to do it, are able to perform to their optimum level, have a sense of well-being, cheerfulness about themselves, have meaningful relationships, and are able to contribute to the society. You put all of this together, that's mental health. But when you talk in terms of post-COVID, yes, COVID brought to light a lot of conversations because a lot of us at one moment in time, most of us actually, experienced distress. And with the advent of social media, which was the main tool during those several months across the world, where we were all indoors, so conversations became more. But that does not mean that mental health awareness has been a recent phenomena. It's been gradually being recognized worldwide. More and more people are able to understand the importance of it. Yet, across the globe, we are far away from where we need to be when it comes to our sense of awareness.
Correct. And how do you think depression falls into this broader context of mental health?
Depression is one of the single largest illnesses in the world. 280 odd million people in the world suffer from depression. And if you look at the 2022 WHO report, then 25% increase was there in depression and anxiety post-pandemic. Depression is a medical illness. It's a mental illness. It's well-defined. We understand by and large what the cause is. We understand that at the root of depression are certain neurotransmitter imbalances, certain chemicals in the brain, which let's say have an aberration, and we know how to treat depression, which is correcting the chemical imbalance, doing psychotherapy, for example, CBT, and some other interventions involving our social support systems. And depression treatment has high efficacy. Response rate to treatment is very good. Most people who seek help are able to reach help for depression end up leading a normal life.
That's a very comprehensive view of looking at the mental health. So, and I think it is especially relevant where still some people think of mood swings when depression is mentioned. So, as part of our iGEM outreach efforts, we had to talk to some high school students regarding mental health awareness. And when we said depression, they immediately correlated it to breakups and relationships and things like that. So, in an attempt to sensitize people like this, what do you think are some solid signs or symptoms that people show when they are going through depression?
So before I talk about that, try and understand why does this happen. See, a lot of these words, which are clinical disorders
Hmm.
in mental health, also are used in the English language.
Right.
So you don't use diabetes or typhoid in your day-to-day language.
Hmm.
But you do use the word anxious and depression and insomnia in your day-to-day language also. So you may end up having a meaning of depression in your, like how we talk, but that may not be depression, the illness. And
Right.
that's why some of these things happen. So to look at this, how do you identify depression? You are looking at sadness of mood, which is almost throughout the day present,
Hmm.
continuously, loss of pleasure, which means you're not able to also enjoy things that you were able to earlier enjoy. And alongside that, you have certain thoughts which are like worthless, hopeless, helpless. Worthless, I don't feel good about myself. Hopeless, I don't think future has anything for me. Helpless, I don't think I can be helped by people. You may experience some symptoms like sleep disturbance, appetite disturbance, weight changes, fatigue, and concentration issues. You may
Hmm.
also experience thoughts that life is not worth it. You may even get thoughts of dying or self harm. Now, these symptoms, most of these, if they are present for, let's say, 2 weeks,
Hmm.
and they are causing a dip in your overall functionality of life, your social, occupational, academic work, personal functioning of life, then this could be depression. If you have this or if a loved one has this, go speak to an expert. And today, thanks to telemedicine, pick up your phone and reach an expert. Don't hesitate.
So that is a very valid point that you brought up. The reason why it is very easily misconceived, the meaning behind the word depression. And also, these are definitely some signs the audience hopefully will look out. And what I noticed is there are different symptoms shown by different people for when they're going through depression. So, relatedly and similarly, are there the treatment approach is different as well?
There are some of these symptoms that I talked about, signs and symptoms, some of them being present, and the impairment of functionality and the duration I talked about. That's how we reach the conclusion of depression. Depression treatment would still be having its own evidence-based guideline approach. So, what will be the level 1, level 2, and so on and so forth. So,
Mm.
for example, to give you an example, let's say typhoid. Some people may have pain as a core symptom. Some people may have headache as a core symptom. Some people may have fever as a core symptom. But the
Mm.
treatment of typhoid, by and large, would remain the same. There'll be some changes based on age and some other factors or other medical issues. That's a separate issue. Same applies to all health conditions, including depression. So, based on your medical condition, based on your age, based on the nature of symptoms, severity of symptoms, but by and large, like I said earlier, you are looking at medical intervention, especially if depression is moderate to severe, psychological intervention, if it's only mild, or otherwise as a part of the overall treatment, which means medications plus psychological intervention. And that's how we treat depression. And this will be the same across the globe. So, you may be in any part of the world, the guidelines and I mean, both the diagnosis and the treatment will by and large be the same.
Mm. So I think this is again, once again, a pretty comprehensive way at looking at clinical treatment methods for depression. Like usually people hear antidepressants and they freak out and they start listing about the side effects it has on the body and things like that. You must have come across a lot of misconceptions, misunderstandings.
I my Typically, when somebody comes and talks to me about this, my point to them is that let's ask ourselves a simple question. Pick up any medication under sun, any medication that comes to your mind, something that you considered mild or anything that you take, and Google it. You will still get a whole bunch of side effects.
Right.
Everything that's mentioned is not going to happen to you. That's not how it works. Your doctor is competent enough to know effect, side effect, adverse reactions, tolerability, dosage, duration, all of that. So it's not that everybody there is one medication which will work on everyone. Some people may respond to some medication, some may respond to something else. And which happens with all illnesses, irrespective of what field we are talking about. Whether we're talking about the mind, the brain, the liver, the kidney, it applies the same. It's an old school thought to think that medications cause dependence. All medications do not cause dependence. It's a very, very untrue thing, a complete myth when people talk in terms of all medications give you sedation. That's actually not true. Only medications which have sedation, where we would want to use sedation as a part of treatment, but most don't. And it's not that if you have taken meds today, you will take them for the rest of your life. Not true. Yes, there will be a duration. So for some illnesses, you take treatment for 5 days or 10 days after illness is over. For some illnesses, you may take it for a year or 2 years. So for example, let's say diabetes treatment, blood pressure treatment, or treatment for cholesterol, treatment for typhoid, malaria, tuberculosis, all of them have different durations, right? Similarly, it applies here as well. First episode depression may have a different duration, a depression which is recurrent may have a different duration, schizophrenia may have a different duration. So that's how it is.
Also, like from your experience, do you think there are any other misconceptions that are important to be addressed?
Lots of them. If you have a mental illness and it's your weakness, not true, it's an illness. I mean, I could get it, anyone could get it. It's not because of me, and I'm not choosing to be ill because you are not doing certain things. That's why it's happening. It happens only because of stress. All of this is a misconcept. Or if you go for therapy, you'll become dependent. That's not true. You would rather talk to a friend and not to a therapist. Again, not true. There are two different aspects. You need friends like more than anything else. You need family more than anything else. But that doesn't mean that in spite of that, you may not need to go to a psychologist or an expert. These are common myths that people have, including, like I said earlier, that meds will be lifelong. All meds are sedatives. You will get dependent. This is all, frankly, rubbish served at different levels of intensity.
Right. So misconceptions like these commonly lead to a lot of stigma, and the stigma surrounding mental health, including depression, can be very pervasive. So, what are some ways that we can collectively work towards reducing the stigma and to like create a more supportive environment?
You're quite right. Stigma is a concern because even today, globally, 70% plus people never seek help, even if they would have wanted to, only because of the stigma and the perceived discrimination that they feel they'll have. An individual is more likely to say that I had migraine and had to take it off, but to be able to say that I had anxiety and so I wanted to take it off. Just imagine going to your workplace, your school, your college, or a family member. That's where we are. And that happens because of the perception that what will people think, what do people say, because of the social narrative that's going around. And the other aspect is it's a young science, relatively speaking, in the sense that 50s was when the initial medication started coming in. That's not very far back. So before that, you didn't have any medical treatment. Then obviously by the time you reach the 70s and 90s, to be true, really where a lot more meds were available. But till 70s, you had just about initial meds, which obviously did not have the best side effect profile because science was evolving and then better meds came. So a lot of these myths are because of that as well. And then, to be honest, portrayal of mental illness in media, for example, if you look at some of cinema, right, you'll see that sometimes it was used for comedy, sometimes it was used to show aggression and violence, sometimes to show crime and psychopathy. So all of this fed into it. Now, as we've become a little bit more aware and we start to understand a little bit more, And like I said, COVID made all of us at a given moment in time experience distress simultaneously, and we were able to relate to that in a different way. All of it has happened. But if the question is what is the change, the answer is advocacy. You don't need to be an expert to be an advocate of mental health. You experts are not going to be the solution to mental health. Advocacy, which basically means you can have an influence with a few people around you. So if each you decides to influence each social circle around you, where you talk of mental health sensitively, with responsibly, you end the stigma, you don't allow discrimination to seep into these conversations, you provide the psychological first aid when people are in crisis, you support people when they are needing to seek help. That's what you can do. The more we do that, that's going to be the change. And change is going to happen through conversations.
Like you said, experts are not the solution to ending stigma. So, as part of our science communication initiative, we aim to build understanding and empathy towards mental health challenges. So, what role do you think public education and awareness campaigns play in achieving this goal?
I think they do. I just feel that awareness campaigns need to be very consistent, need to be at multiple level, because if you have to make a road in a mountain, you don't chisel or you don't uh, try to break the wall only one odd day a year and then expect for the mountain to open up a road. That's not how it's going to work. You keep doing it every day and everybody keeps needing to do their part. And that's how you'll be able to have some light at the end of the tunnel.
Right. Consistency is key. Is all of us at ITM and iGEM are definitely noting this down. So, considering the broader societal impact, how does depression affect the overall well-being of the community?
See, let's start from very basics, right? Let's understand if an individual, irrespective of their age, and let's look at a young adult, that individual is having, let's say, depressive features. What's happening? This individual is not able to do their work or academics, which at what age group they are. So they themselves start feeling more pressure. It affects their life. It takes them a few steps back because they aren't able to function at their optimum. That results into what happens in their immediate social network, and it affects their finances, their relationships, their physical health. All of that starts happening. Let me give you a few examples here. Globally, it's estimated that around 12 billion working days are lost every year to depression and anxiety. And the cost is about 1 trillion US dollars per year, loss in productivity. So if there was a number that should bother us, this is that number.
Mm.
And by 2030, this number is going to be $6 trillion a year of cost. Cost in terms of direct costs of care. This cost is, and adding on to the other cost, which is cost in terms of opportunity loss, absenteeism, various other factors, and that's somewhere, and the social costs, right? So try to understand this. It's a you're looking at life, the essence of life. So when life gets impacted, every aspect of that life tends to get impacted. That's how one needs to understand.
Sir, you mentioned that in a few years the costs are going the loss is going to be around 6 trillion. So what do you think accounts for this increase? Are you saying that as a society we are becoming steadily more depressed?
No. I don't think that's the right way to look at it. Understand that right now, I talked about that you are looking at 280 million people in the world having depression. 12 billion days are lost a year to depression. We had a 25% increase in just the post-pandemic. 70% plus people are not being able to seek help. The reason here is not increase of depression. The reason here is not getting intervention for depression and anxiety.
Right.
Please understand that.
Right.
The cost is happening because help is not reaching.
So also, as an established figure in your line of profession, you must have come across all classes of people, right? So, and the pandemic has only like highlighted the disparity that is there between the communities when it comes to access to healthcare, as well as the impact of the disease itself. So, how do you think this disparity can be bridged? How can we make mental health more accessible to all parts of the community?
I mean, lots of answers I can respond to, but I mean, equity, equality, and disparity. Let's accept it. I mean, that's across us. I mean, you look outside the window and there is inequity. There is disparity at multiple levels, and that disparity will impact at all levels. Why mental health alone? It will be about your basic hygiene. It will be about your nutrition. It will be about your overall health. It may be about your quality of life. There are so many parameters, and people are living in areas of conflict. People are living in there are so many components which impact a person's sense of self and sense of well-being, and we must understand this. But to look at the solution, how I look at the solution, I think telemental health is probably one of the best equalizers that I feel is there, because it has actually bridged the gap in the true sense. A person like me sitting in an urban city where I sit, I would largely see people only from people who can have direct access to me. And that will apply to all colleagues sitting across the country or across the world. But people who did not have easy access, tier 3, tier 4, rural, for them to reach an expert was a challenge. And the cost of reaching the expert was also there, not just the cost of, let's say, treatment per se. And there is public health, and we have a robust medical system in our country. Government healthcare is providing for mental health services in a very, very significant manner, and we must understand that aspect as well. Yet, outreach, and access was an issue. What's happened now is that now you actually have that wherever you are sitting, the click of a button, you may get an expert across the country. That, I think, is going to be the key differentiator, and alongside integrating mental health in primary healthcare and utilizing the last mile connection of healthcare, which is the primary healthcare centers at a rural level, and ensuring that basic mental health services, medications, guidance is available there, while we continuously do advocacy and do consistent initiative for awareness. And we work with schools at a very, very deeper level to be able to enable young people to have a lot more of life skills and skill set to be able to navigate life better and never hesitate in seeking help. So some of these things, if we combine and do them consistently, that's probably the way forward. I mean, we can feel the burden of the numbers, and we can feel the burden of the length and breadth, the sheer distance and the population, and so on and so forth. But it's the side you look at. I mean, you have an option to either look at the problem or you look at the solution. If you look at the solution, you'll find it. But if you keep thinking about how big the problem is, you'll never reach the solution.
Thank you, sir. It has been very helpful. And also, for the final question, last but not the least, is there any key advice or message that you would like to convey to the general public regarding mental health and depression?
Mental illness is as real as it gets. And health is not health if mental health component is not a part of it. Nobody chooses to get any illness. Nobody. I have a thyroid disorder. I didn't choose. It so happened my body didn't make enough thyroid. Simple as that. So I am taking the medication given by my colleague from the field of endocrine, an expert in that field, and my quality of life was fine. Mental illnesses are illnesses as real as any other illness. We need to come out of the stigma, the discrimination, our prejudice, and our faulty, lopsided understanding about mental illness that we've probably seen, heard, read from unreliable sources. You talk to a subject matter expert if you have doubts and queries. Yes, the internet gives us a lot of information, but all of it may not be true. You will still need to go to the right source. But mental health as a solution is not only about experts. Mental health as a solution is also about advocacy, and everyone can be an advocate of well-being. Your happiness, happiness of your friends, your family, you can contribute to that. Values, positivity, optimism, hope, these don't come through medications. This is what we imbibe in ourselves. And then we spread this. And in spite of all odds, we continue to do this. And we are aware if we have a problem, go seek help without hesitation. That is the only way forward.
I'm sure your words will be very validating for someone who's actually going through a difficult time, or people who are close to them are facing any mental health challenges. So, thank you so much for joining us today. This was a very wonderful conversation. Thank you so much for taking your time and for making this happen. Thank you once again, Dr. Parikh.
Nice to see young people taking time out for mental health. It only gives hope to me, because when young people talk about the right things, that's shaping of the future in the right manner.
Thank you.